morning. Welcome to our 52nd, I'm jumping ahead, 52nd Coffee with the Commissioner event this morning at 6:30 a.m. And once again, we're talking about COVID-19, the impacts on the community, and from different perspectives this morning. We have a special guest in the house, DC Reeves. He is the owner of the Perfect Plain Brewery downtown. He also owns Garden and Grain, which is the ancillary restaurant behind it. And DC is also working on some other cool things downtown. We're going to look forward to talking with him about that. We also have Escambia County Emergency Manager Eric Gilmore here to give us an update on hurricane preparedness, as well as the latest COVID-19 numbers. And then, of course, our County Administrator Janice Gilley's here. Good morning to all of you all, and thank you for being here.
Good morning.
Well, we're going to start right off with Eric Gilmore. He's got another commitment later this morning, actually right away. So we'll let him give his update. Eric, you want to talk a little bit about hurricane preparedness, and then just kind of roll right into COVID-19?
Sure. So, we're still in hurricane season. We're getting into what I like to consider, we could have a hurricane anytime during the 6 months, but we're getting to our area where we start seeing a lot of hurricanes come into the Gulf. So right now, between now and mid to late October is when everybody really needs to be vigilant, pay attention. We do have a tropical depression out in the Atlantic right now. It's not anticipated to impact us or get into the Gulf. They've got scenarios where it downgrades or dissipates or even recurves out in the Atlantic, but nonetheless, they're expecting a higher than average season. They even up that number, so they even added more named storms. So we're not seeing that right now, but like I said, all it takes is one. So everybody still watch that and be vigilant out there. So make sure the three things we've been pushing: know your zone, know your home, and know your plan. So make sure you're doing those three things to be prepared. So that's my hurricane preparedness talk. So
hey, let me ask you something real quick on that, Eric. We used to have Molina Park Elementary School as the shelter for folks with animals. Is that still the case? Do we still have that deal with the school board?
Yes, we still do. So that is our pet-friendly shelter. And if you have a pet that you're evacuating with, that's where we ask you to go. So yes, sir, that is still stood up during times when we stand up our shelters.
And do we still have adequate number? I know for a while there we had a difficult time getting volunteers, and now with COVID-19, I just wonder, a lot of the folks that volunteer are senior citizens, maybe folks that are more susceptible to this virus. Are we still okay in terms of our numbers of volunteers for these shelters?
Well, Red Cross is having a hard time because of the elderly population that they utilize. Their staff is a lot older, and they will have some staffing issues, but that's why we're using county staff to backfill and augment. So we have a manpower pool. As a matter of fact, I've already done some shelter training with our county staff, and I'll continue tomorrow with our shelter managers and get those guys wrapped up. So we've got a plan to backfill in case we do not get the volunteers that we need. So.
Right on. Well, obviously COVID-19, our dashboard, fantastic. Any movement on getting a recovered number on there? Because again, the thing that we keep seeing is that big top line number. Now it's up to 9,807 positive tests, but that's from March through now. So a lot of those are resolved. Have we any movement on that, Eric?
There is a little movement going. So good discussions last week. I was in Tallahassee last week at the State EOC. Good discussions with Dr. Blackmore and several of the DOHP personnel up there that they were talking with CDC, trying to come up with a definition for recovery. So I'm hoping that we get a statewide definition that we can all follow, and the state of Florida can start rolling some of these numbers off. So I think they're going to work toward getting something with CDC. The issue they were having is the PCR test. Right. I've heard the doctors say you could test positive for up to 12 weeks afterwards. So if you're testing positive with your PCR test because you got remnants of the virus in you, is that recovered or is that not recovered because you're past your 10 to 14 days? So that's what they're looking at right now, and that's what they're trying to overcome. So the PCR testing seems to be giving them fits for a definition of recovery if you're still popping positive for weeks afterwards.
Hey, Eric, let me ask so that everyone, because I'm still confused about this. So you're testing positive up to 12, 14 weeks later, which is kind of scary in and of itself, but are you contagious? I think, didn't they back that down to like 14 days and say you're not contagious?
They did do that, but so it's just a matter, it's the testing parameters. So like I said, you pop positive. So that's what they're trying to say. You're not contagious, but are you still, so do you still have the virus live in you? So they're working on a definition. We're trying to get there. I really had a good discussion with them last week because that number just keeps growing and it's never going to go down. And it's just going to look like we're just out of hand if we don't.
Exactly.
And showing who's recovered. So no, you're absolutely right.
Well, I hope that they can get to that. I mean, that would help because right now, we're the scarlet letter state. I mean, unfortunately, we're getting beat up, and it sure would be nice to say, well, yeah, but in Escambia County of this 7,800, we estimate based upon this formula of 6 weeks after testing positive that you either recover or unfortunately you succumb. And, we're using this formula like Iowa, it looks like, 6,500 of these are already recovered. That way, you're not walking around with an army of 9,800 people that are contagious coughing because that's not happening. But anyway, that's one side of the story. I think the state of Florida needs to really, hopefully they can get that. And thanks for having those discussions because Escambia County, even if the state can't do it, I still think we need to move ahead, plow forward and just do it. I mean, could we do it? Could we just say, we're going to do it anyway? Could we do that?
We can, but I'd like to be in lock and step if the state's going to do this, and I'm hoping they'll take the lead on this, that we're following their definition and we're doing it statewide altogether so that other counties, we're using all the same definition and case definition for recovery. So I'm hoping pretty soon we'll have something.
Okay, right on. Final thing, and then we'll go to Janice. Thank you guys very much for bringing that rapid test state vehicle out. I know there was a little bit of angst and gnashing of teeth. Some folks were upset because we ran out so quick. Any chance we can get that thing back to the equestrian center loaded up with some more tests? Because didn't it run out like within an hour and a half the second day?
The second day it went out before an hour. They was only there like 50 minutes, and they did 200 tests. It was well received by the community, and unfortunately, a lot of people who were still in line did not get to do a test.
Whoa, did you say still alive?
No, still in line. Sorry.
Okay. I mean, what?
No, still in line. So unfortunately, they didn't get to get their test. But that's the purpose of a rapid test is the laboratory equipment can only handle so many tests. And to get the rapid test results back, 200 is their max to be able to run them that afternoon and at least get you the test results by the next morning. So if they went beyond that, then it wouldn't be as rapid because they would be running tests and they've got other sites to hit. So we will try to get that site back. I've got another asset that I've got eyes on that's going to be, it was being built out while I was there in Tallahassee. Mobile testing trailer that's going to come with a nursing team. It is not going to be rapid. It is going to be nasal swab, and they'll package the test and send them off to a laboratory. But the laboratory has assured them that they can have a 48-hour turnaround is what they've told them. So we're trying to get that trailer in the county as well, and we'll have another asset to be mobile and move around to the north end of the county as well as the west side of the county as well, again. So.
Right on. Well, Eric, we understand. We know you got to run to your next radio interview. I appreciate you being here on these morning chats. You really always have your finger on the pulse. Thanks for all the work you did in Tallahassee last week. You just represent us so well with distinction. So thank you for what you're doing. Good luck this morning on the radio. I know you'll do great. So you get lots of practice here.
Absolutely.
Hey, and I did want Eric, I don't know for sure exactly when he needs to go, but I did want to make sure that he mentioned a couple of other things that he learned in Tallahassee about how much they're spending a day on testing in the state of Florida. And then also the types of testing that they're looking at. Right now, we are focusing a lot on asymptomatic, but kind of maybe how the future might look. Eric, if you want to share that.
So absolutely. So right now, the state's spending about $7.5 million a day.
Wow. On
community-based testing sites. That's your mobile sites, that's your drive-through sites, that's your walk-up sites, that's your pop-up sites. There's about 95 test sites throughout the state of Florida, and you figure you got nurses at each one of those locations, laboratory testing equipment, incident command teams, tents, equipment, hardware, so $7.5 million a day. I spent most of my time in Tallahassee last week trying to right-size some of that and work with those and the vendors to try to cut down some of the costs and see what was really warranted out there, what was really needed. And we was looking at those test sites that were underperforming and not getting the results that we needed. So that was one thing we did. And it was last week that they transitioned that all mobile site or drive-through sites, such as our UWS site, start implementing antibody testing. So antibody testing will be implemented at all drive-through sites throughout the state of Florida. And they're they're doing a little transition. It was, symptomatic, asymptomatic, all come one, come all, you get your test. They've, like you take the Miami Hard Rock, they've got 8 drive-through lanes. They cut all those lanes down. 7 lanes will be now symptomatic lanes only, and 1 lane will be asymptomatic. So they're really trying to target symptomatic testing right now. Although they still offer asymptomatic testing, but it's not as readily, they don't have the capacity like they did before. It was just all lanes were just go. So They're trying to go to more of a symptomatic strategy right now. So that's the state. They're transitioning to that symptomatic strategy.
Hey, Eric, let me ask you a quick question. Do you think right now is Jeff Bezos or Elon Musk, is there one of these super high-tech guys that's going to develop a home test for us? I just really think the private sector is going to come through. The government, God bless them, they tried, but they bungled this thing. Now we got 14-day waiting periods. Everyone's blaming everyone else. Do you think the private sector, just like, a home pregnancy, are they going to come up with something for 1995?
I'm willing to bet, yes. I'm willing to bet you that's going to happen. They've got the cassette out there that does antibody testing right now.
Right.
So pregnancy test, and it's a finger prick. So the antibody testing at UWF is a whole blood draw. So you actually get a blood draw at UWF. So you need to know that if you're wanting antibody testing. So it's a blood draw, but they still put it on a cassette, which gives you a better result than just a finger prick. So you get a more accurate result. It's a higher accuracy than just a finger prick. But yes, I would say that yes, the private sector probably will develop something for home testing. Honestly, so
I really think
I saw in England. I did see in England where they've done a spit test where they're giving kids to families. Yeah, and so the families are getting tested each week. But I don't know exactly. I'm sure they have government health care there, so I wouldn't necessarily guarantee that was a private endeavor. But I do know that they are doing spit tests by family each week in England. Is
it accurate? Do we know?
I do not know that.
I do not know the accuracy on that. Yeah.
Yeah.
Why don't we get that here? I mean, I don't know. It's kind of frustrating because a lot of folks want to get tested. I mean,
right.
And it just seems like you wait in line and then you wait 14 days. I don't know, but I just appreciate everything you guys are doing. Now, final thing, and then we're going to get to DC and all his cool stuff that he's got going on. Century Correctional, they came out with these gigantic, humongous numbers, and it really skewed Escambia. People freaked out. Janice, why don't you tell everyone what's the real story with all those big numbers over the weekend and stuff?
Yeah, so what happened, Eric and I have been trying to and along with Marie Mott at Florida Department of Health, trying to get this run to ground. So the Florida Department of Health had been following, the DOC had been following the same guidelines we had been following, which is if you had a symptomatic inmate, then you would do the testing. And then you would medically quarantine them and things like that. And then if you did find that there were more than one in a unit, you would, then medically quarantine the actual unit. About a week ago, from what we can tell, the state started paying for teams to go into the correctional institutions and do a test. So what they were able to do at Century, they did because they brought an entire team in. It wasn't their local staff that did that. So that's why Marie Mott and I had been having a conversation about if we needed to do that at our jail, if we had more symptomatic inmates than we currently have, how would we accomplish that? So what happened?
Let's segue real quick to our jail, because we had Rich Powell last week, and I was astonished when he told me, there was just a couple dozen that were still had it, and most of the people had recovered. What's our current number over there at the jail?
We had 11 active positive cases yesterday, and we had 2 pending. So we had 2 that had asked for testing. Mm-hmm.
And that means the rest of the population, 1,400, whatever that is, we don't have people running around sneezing, coughing with flu symptoms, because they'd be flagged if they did, right?
Yes, sir. We do have our, like I've mentioned, we do have our medical professionals going in and checking, and then asking as well, are you interested in the test, or do you need the test? We've moved to that stage. But as of yesterday and the day before, I'd not been informed of any massive numbers of those that have had symptoms or that have requested or taken the test, other than the 2 that requested yesterday. So, but those big numbers, I was a little bit surprised by the numbers. When I looked at all the other institutions, correctional institutions across the state, Century was a 50-50. It looked like 753 and 745, negative to positive. And when you looked at other facilities, it was like 1,220 to 32. So it was just kind of interesting to look at that number. And I talked to someone yesterday about it. I don't understand the correlation, given the different facilities. I don't know if everybody did a full-blown testing like Century did, but it was just interesting to see some institutions had hardly any positives, And like I said, Century had 50-50. But yes, they did dump all of those into our number, Escambia County number, because they are residents of Escambia County. And so it did skew our numbers. And I
Well,
think they were down to about 32 that had not gotten their results back yet.
well, when we look at the dashboard this morning, we see 72,935 residents tested. 9,807 is the number of cases. Cumulative 563 total hospitalizations since the start of the pandemic, and then 207 current hospitalizations. And really, that number is lower from a high of about around 250. So I think the hospitals are doing a great job. You know, we've had those guys on our coffees and talked to them. But the death count, let's quickly talk about that, because we talked a little bit about this before we went live. We were showing 131 deaths, and we get hit over the head with these giant numbers. Obviously, every death is a horrible tragedy. It's terrible. Somebody died, someone's loved one, someone's family member, but 131. But the press gets a hold of this giant number. And what we're finding out now is these are deaths that happened July, earlier last month. And Eric, you were saying something about post-mortem, they're finding the COVID and then they're tell us what you think, what the speculation is on how these are coming so late after people die.
So the speculation is they're testing them, and then the test results are even delayed, or they're just getting them back late, and then they're trying to apply them back to when it happened, and then that number hits the day of when they get the result back. So if I passed 3 weeks ago, they tested me, my test results come back 14 days later, because it's not urgent to get that test result back immediately. So it's not going to be as rapid as what we're doing real time, trying to get it real time right now. Then my death hits that day, and then we get a cumulative death rate of that day when they all hit, or when they're all put into the system. It might be that they're backlogged and they all get put into the system on that day at that time, and that's why that number gets so absorbent. So that's just speculation here. I haven't got anything in hard evidence on that, but the 11 deaths that we accumulated yesterday some of them were in July, late July. So it's not that they all expired in the last 24, 48 hours. It's over a period of time. So
I sure wish the media would say that. I sure wish they would explain that, because what they do is they panic a lot of people. But importantly, though, this to me is newsworthy. And I'm going to find out, how would I find out more? Because to me, if grandma died of a heart attack in mid-July and she passed away, and then subsequent to that, there were some tissue tests or blood tests run as part of the autopsy, and they found that she had COVID, for them to come back 2, 3, 4 weeks later and say, oh, this is another death, that seems a little disingenuous to me. What are your thoughts, Janice and Eric, on that?
So I think I've mentioned before that the medical examiner also has, I don't want to say a backlog, but I know that the medical examiner, because some people have waited too late to get to the doctor and have died at home or in facilities, they've also been having to do some extra testing of those individuals when they're doing autopsies. And that could also be part of the delay in terms of when people get notified, to the Department of Health that their death may have been COVID related. When we heard yesterday from Department of Health that some of these deaths, because they originally reported 11, and then we were told it was 13, that 2 of them came from the beginning or the early part of July. I said that is just not going to go over well.
No, it's not.
Yeah.
Well, because it just seems dishonest to me. I mean, look, none of us are getting out of here alive, right? People die every day. It's a sad thing. It's terrible. It's a terrible reality. I went to a funeral 2 weeks ago, and I'm going to another one. We had another friend that just passed away of COVID. But if someone dies of some other cause, and then after the fact, they're providing some kind of a test to the body and then bringing that forward and saying it's another death, that just doesn't seem honest to me. It seems dishonest. It seems disingenuous. It's almost like what you hear about the motorcycle crash victim. It's like the urban myth online among some of the conspiracy theorists that the motorcycle crash victim, they did a blood test and oops, he had COVID. So he died of COVID. I mean, I don't think it's that extreme. I hope not. But if they're digging up autopsy, tests from last month and saying, and adding it to a total that they're dumping on the 6 o'clock news today, I think that's a problem. Don't you?
Well, yeah. One of the questions that I was asking is, were these people that were visiting somewhere else and died? And because they
Wow.
were, Escambia County residents, it just got reported to us. And so I don't have answers to those questions, but we did ask yesterday. As of yesterday afternoon, DOH didn't have an answer, except for that's when they've been reported to them. So I do agree, this does need to have a little bit more in depth, and Eric and I'll discuss it later in terms of how we might be able to peel this onion back, because I agree, people need answers, and it is very scary when you hear that 13 people died in one day, and we don't really have the ability to tell every single, resident that it's not 13 all in one day.
Right.
And then when they say, okay, well, that it wasn't all in one day, when was it? And you say, oh yeah, this goes back 6 weeks. That's disingenuous as well.
It really is bad. It's very bad optics. It's terrible all the way around. And whoever's doing that at the state, they need to knock it off. It's ridiculous. It's scaring people. It's just not right. Well, hey, we have a
Let's talk about something happier, right?
well, yeah, okay, here we go. Here it is for you. Maybe you can help me with this. We have a request. We have heard that the schools are requiring parents to sign a hold harmless agreement for students to attend brick and mortar schools. Have any of you guys heard of that? Boy, that's a scary thought. Can you imagine? Okay, you want to send your kids back to school, but now you're going to sign this agreement. Have you heard about that? Is that happening locally?
Is that Escambia County? Is that local? Right.
They didn't specify. I don't know.
I have not heard that, but
And you have kids in public school, right?
I did. They're all
Absolutely.
graduated now. They're now in public colleges, and I'm paying the checks for that. Thank you.
I have a first grader, about to be first grader in public school. We have not been asked that. So I don't want to speak to, but certainly that has not come up at all, or I've not heard any parent discuss
DC, what would you think, man, if someone gave you that to sign?
I don't know that I'm not sure that I would sign it. I don't know, it seems kind of crazy. I mean, but yeah, we've gotten a lot of communication from schools, voicemails and stuff like that. And we've heard nothing of that. I would imagine if that was true, or that had already happened, we'd be hearing a lot about it from parents.
Yeah. Well, like I say, it's just a question that came over Facebook, but well, okay. Janice and Eric, thank you so much for that. We're going to now get to our special guest, DC Reeves. He's waited patiently while we go through the mundane reports and the county business. But DC, why don't you tell everyone who might not be familiar with you, what you do downtown, what you do. Eric, thanks for being here. Good luck on the interview, and we'll see you next week. Actually, no, we won't see you next week. We'll see you next month. This is the last one before the end of the month, with a lot going on vacation and stuff. So we'll see you, Eric. Have a good one. All right, DC, without further ado, what do you do, man?
Yeah, I know that's always a good question. I feel like I should have like hats, like a football recruiting, ceremony. Yeah, I do a few different things. If you aren't familiar, I was born and raised here. I went to Florida State and spent 10 years as a sports writer, covered college football mainly, Florida State. And then the last writing job I had was at the Tuscaloosa News, covering the University of Alabama. And then moved back here to work for Quint Studer in 2015. Then got the entrepreneur, really part of the feeling of wanting to come back and kind of end a career that wouldn't have brought me back to Pensacola in college football, was, I kind of had some entrepreneur blood in me. And I always felt like I didn't know at that time what I was going to do, but I just felt like I would, but if I was going to do anything, it would be here, and just because of my familiarity with the area. And so we started brainstorming up a craft brewery. I traveled as a writer all over the Southeast mainly, but really all over the country, and said, man, this craft brewery is cool. I wish we had one like that, back where I'm from. And so I got to see a lot of different places and see what seemed to work. And so the funny story I always tell is that I remember Reed O'Neill, my co-founder, and I were kind of investigating this idea. We're in Asheville, North Carolina, where he lived. And we always say how we were looking up somebody else's blog who opened a craft brewery, and it took them 2 years to get it open. And we're like, 2 years, like, man, these guys didn't have their ducks in a row. Like, they didn't understand anything about, we were going to get it done way faster than that. And then 2 years and 15 days later, we opened. So,
2 years.
Yeah, exactly. So it's a good lesson in humility, and 17 permits that it takes to open a brewery between county and state and federal and city. And so anyway, but I tell that story to say both, and we're almost 3 years old now. We'll be 3 in November at Perfect Plain, but it also feeds into the other part of my life, which is I've been through that entrepreneurial process, and kind of recently too. there's a lot of people in this town that know more about operating a business or running a business as a CEO than I do, but I have been through it in this city, in this county, and I've felt some of those challenges myself. And so the other part of my life is as the chief entrepreneur officer, Entrepreneur Hub, which Quentin Rishi started. And Quentin said, basically go around the country and spend 6 months and figure out what are the best practices and find out what our gaps are in our entrepreneurial ecosystem. How can we best serve small businesses in our community? And as you know, Quint has given money to entrepreneurial organizations and practices for years. Of course, namely the UWF Center for Entrepreneurship. They donated $1 million to start that with the hopes of it being downtown, and with city politics that kind of got foiled. And so it's something that's important and that he's passionate about. And so that's what we did is we went to Asheville, North Carolina and Madison, Wisconsin. And we polled 134 small businesses in our community to say, what do you need? What are we missing that could help our businesses? And we can get into that, but we found those 3 key buckets. And so that's my double life is, now it used to be as chief of staff for Quint. I usually would just take on whatever our largest project was or initiative at the time. But we both are excited about this one in particular, because unlike, the Scape waterfront project where, I had to learn on the fly, I didn't know a lot about waterfront resiliency until you spend 6 months doing it. Right. Or appointed superintendent or whatever the case may be. Those were so rewarding and I learned so much, but now this is truly like what I do for my own life. And so this is also the first project I've had that doesn't really have an end date. We're going to continue, for in perpetuity and try to and at the end of the day, the spring exists because we want to raise the wage index. We want to create jobs through small business, which is, despite what you read about, attracting big companies and things like that, it is the vast majority of the source of our jobs in any community. And so if we can make smarter CEOs and smarter businesses, what do? They hire more people, they become more competitive for talent. And so this is our tactic to be that front door for entrepreneurship that we hope that can serve our entire county and really our 2-county area.
Well, and timing couldn't be better. We're going into a recession. We're in a recession right now, a very deep one. In fact, I just heard that on the radio before we walked in this morning that Great Britain is in one of the deepest recessions they've ever been in before, because they're so locked down in their economy right now, trying to fight the COVID-19. So, when we come out the other side of this, more than ever, we're going to need things like the Spring. We're going to need things like CoLab to help support and incubate these entrepreneurs, these small business, local small businesses that are so vital. When I was on the school board, DC, one of the things I always thought were the holes in our curriculum that I always thought never got plugged was that whole entrepreneurial part. That's why I'm so strongly supportive of junior achievement. They help. But I really believe that kids, when they're in school, should be taught about that. I mean, that is the lifeblood of our country. And like you, I've gone through that whole process, SBA loans, opening a business, opening a second, opening a third, the battles, trying to make payroll. I mean, everyone should have to go through that. Then you really understand the value of a dollar. When you got to make payroll and, you're counting on a big weekend to cover the payroll. I mean, that's something that's called living on the edge. So coming out of this recession, we're going to need CoLab. We're going to need the Spring. We're going to need all hands on deck helping our local small businesses. And I agree with you. The small businesses are the key. Now, I also think you at the same time always have to have the eye on the ball, trying to get the big guys, the Navy Federals, the ST Aerospaces. I'm an all of the above guy, small business, big business. I certainly want the big companies coming here, not Mobile, Alabama, not Fort Walton Beach. I want them in Pensacola, Florida. I want them in Escambia County. But let's kind of transition now. We know you set the table with what you do. Tell us quickly though about your new thing with Michael Caro down there. Tell us about that.
Yeah, so we're going to actually open. That's our third expansion. Third expansion. We've got one already underway next door to us called The Well, and then we're going to open Perennial down at Palafox in Maine. We're going to run the bar. We did those new food trucks, and it looks great in there. And he's brought a bunch of great proven restaurant tours. CEOs that as Michael will tell you, kind of. When you start that first iteration of your business, you learn your lessons of, it's a little hot out there without a roof. you know, and finding people that really have, you know, understanding of the food business means they'll stay longer and they'll, you know, create a more quality product for people to enjoy. So that's really what we signed on to, is that we felt like they were really curating this list of great places and that we know will do, you know, expect quality and have a standard of excellence of what they want their name on. And that's certainly what we look for is, you know, we don't just jump at anything that's available. We want something that we can be proud of, you know? So yeah, that should open in the next 60 days, waiting on our federal brewing permit. So interestingly enough, not to get too far into 3-tier distribution, but technically it's a second brewery location. We're allowed to have up to 7 offsite brewery locations in the state of Florida and distribute to ourselves without a distribution agreement. But so we are actually going to have a couple little brewing tanks on site and have some fun with those, maybe some root beer, maybe something,
Nice.
you know, and but with that comes a federal brewing permit, then a state brewing permit. So kind of joking like earlier, you know, so I have a goal of when I want to be open, but a couple things are out of my control.
Just don't make it 2 years though. Come on.
Right, exactly. Yeah, we're in real problems. You know, I'll owe Michael Carroll a lot of money if it takes me 2 years.
I would
Well, hey-
love to hear you debate the 3-tier system.
Yeah. I would say. I mean, we could do a whole hour on that. Let's do
Yeah,
it.
at least.
Yeah.
Get you and David Bear.
Right, exactly. That'd be good. That'd be good. We have done that before. I mean.
Oh, okay, I bet.
But anyway, yeah. So we're really excited about that project, and I want to add on to what you said earlier, Jeff. You know, I think anytime there's a recession, you can look historically. You automatically a move to entrepreneurship. There's more interest in entrepreneurship, and it's obvious reasons, right? You either lost your job,
Right.
got your hours cut, you've got that idea that you've always thought would work, you know, but you know, you'd been too stable in your career or your career was growing. And so we've seen that time and time again, is that, you know, more business license applications, more, you know, there's metrics that follow a recession of there being more entrepreneurship. And same with us. I mean, our goal is to start the spring, we're going to have a physical space at the first floor of the SEI building, the old SunTrust building on Garden Street.
Yeah.
But obviously this COVID threw a wrench in that. So we pivoted and we said, all right, well, and for anybody listening out there, we're doing this right now on our website, thespringpensacola.com. Any business owner can reach out to us remote and fill out a quick form. Here's what we're looking for. Hey, we need legal advice. Hey, we need help structuring an LLC. And we aren't going to answer all those questions for you. You know, if it's bar or brewery related or something, you know, some marketing related things, I can probably be helpful. But our goal is to get you to the right place. You know, we probably know an attorney that has an answer for that. We probably know somebody in branding if you had a quick question, that kind of thing. So to really be, to use Quint's old hospital term, it's really the triage. That's what we want to be. You know, you come to us, we're going to get you to SBDC, 1 million cup collab.
Yes.
So if we do our job correctly, we lift the entire ecosystem. This is not, we're doing something that SBDC is doing or stepping on toes, as the old cliche goes. That's not what we're trying to be. We're trying to say, we knew from our polling and our survey data that from those 134 businesses that the things they missed were mentorship and you know, funding, of course, and a physical front door. Where do I go to begin? You know, and so we want to fill that gap as best we can. And I agree. I think we're going to see this big wave of entrepreneurship of people saying, hey, you know, no better time than now, you know,
Absolutely.
gotten out of this and we want to, you know, start this idea.
Well, and like you said, coming out of the recession, a lot of folks, unfortunately, you know, will find themselves out of work, and they'll have perhaps, you know, the opportunity to cash in a 401k, you know, without a penalty to start a business. They'll have some seed capital, hopefully, you know, depending upon what the stock market does, right? I mean, we hope they have money left. And so they will come to an organization like yours at the Spring, and you will put them together with SBDC, small business, collab. I mean, the folks got to realize there are resources out there that most people don't know about the SBDC and what they do. I found out when I was doing business development a couple of years ago for my boss at the base. Incredible resource, but most people just don't know about it. They don't know about all the opportunities to work and contract with the federal government, opportunities on FedBizOps. They just don't know about it. And so I'm sure you're going to be able to connect those people, right? I mean, that's part of what you do.
And that's the phase we're in, obviously being new. But it's funny. We probably talked to 50 to 75 businesses in the last month. I mean, I usually have at least, about 90 minutes of calls a day with, on average, with small business owners. And anybody listening who isn't sure, hey, do I make sense to talk? We've talked with people all the way from pre-idea, basically they have an idea and that's it. And they're like, what's next? To, I've got a call on Thursday with someone who's been in business on the beach for years, so it's, hey, it might be something about marketing or something like that. So, we don't only service, we feel like we were filling the gap of that pre-revenue, and understandable. Look, if you talk to SBDC, their metrics are based on, let's take Perfect Plane with 15 employees and get them to 100 employees.
Right.
That's create jobs, which is totally understandable and needed. Mm-hmm. But it's not as as they call, the white unicorns aren't as efficient. The 0 to 15 employees, don't hit as frequently. So when you're having to go off metrics, but with us kind of being private and, eventually obviously having, donors or partner organizations like our EDA or, Gulf Power is already supporting us in our efforts. And of course, banks and law firms and Gulf Power, all those people, want to see us grow and prosper, and that's more customers. Sure. and all those things. So we're all in lockstep together. But, we really want to hit that target of people that the kind of the kickstart point gets left behind sometimes because it's not as easily trackable, or somebody might talk to us for an hour and say, you know what, we're not going to do that idea. That's okay too. Right. That saves someone a lot of money, or their 401k, or, our to make sure that everybody starts a business. Our goal is to make sure that they're making a smart decision. So,
well, DC, here's a good point to interject right here. You were instrumental. I know we worked together a couple of years back to get that ballot initiative passed for the appointed superintendent. I think that was really going to create a transformational change, particularly if they hire the right person. But I don't want to get started on that.
Right.
But I think there's a great synergy to be had between the Spring and the public school district here. And I really, I don't know if you'd be willing to do it, but when we have a new superintendent, I think it'd be a great thing to do in the senior year, just do the travel and tour to all the high schools and just, they do assemblies, when we get past COVID and you can do it, and just get out in front of kids and tell them, hey, this is America. You could start a business. Look at me. Here's some examples. Here's some inspirational people. This guy had an idea for sports apparel. He became a billionaire. This is America, because that's something that's missing from the public school curriculum. So far as I could tell as a 10-year school board member, would you embrace doing something like that?
Of course. And actually, I'm glad you brought that up. We're at the college level. We're working on that literally as we speak with the University of West Florida. But here's what we saw, and what and I give Rick Fountain, the new dean of the College of Business, a lot of credit for this. Where we are partnering with UWF to come up with a certificate program for entrepreneurship, which could be for someone who's 19 or 25 or 55. Cool. And we cut out a lot of the red tape. It's not, you don't have to go enroll. You don't have, but eventually you will be able, as a student, to be able to take it for credit. But we want it to happen downtown. And what we really want is this 7-week, 30,000 foot view. We're going to spend a class on, we're going to spend a class on how to read, P&L and basic financing, bring a banker in 1 week, those kinds of things where you get a lot of high level touch points. And we feel like, just like you said, perhaps in the past with UWF and other universities, just having the Center for Entrepreneurship kind of requires that the student come find you, and like, yeah. Okay, well, at age 18, at age 19, I want to be an entrepreneur. Well, you're not going to find them. The entrepreneurs are in the engineering school, and they're in other places, and they don't know it yet, but those are the entrepreneurs. And so what I love about what the College of Business is doing now, and what we're talking about, is it should be accessible, and there should be outreach throughout the university. So a certificate program like this, or eventually something that's 1 credit hour, they got to fill that credit hour anyway with some kind of elective. Why not go get a cursory understanding of how to run a business? And
that's awesome. No, that's great.
And we talked to actually a perfect example. I talked at a class where same thing, it was a 1 credit course from people all over the university that was already in place now. And a guy, they were having to make a product. And I asked him, I said, so do you guys really, actually want to make this? They're like, I don't know, I'm going to be a mechanical engineer. And I said, well, you don't, 10 years from now, you might be calling us back. I mean, you don't know that, you might want to go get a job and a steady income now, but just having that understanding of how, and taking the intimidation factor away from, starting your own business, who knows the kind of impact that could have on a high school student or a college student. They don't have to.
Absolutely. No, it's profound. I mean, it's profound. I owned my businesses before I got my master's degree in public administration. And so when I went back and got my master's degree, I had a lot of aha moments. I was like, oh, okay. Yeah. Oh, now I understand. That's what I was doing wrong, or this is what I did right. And I just didn't know what I was doing. But that's really cool that we have this in the community. And I think a lot of folks don't know about it. And I look forward to really getting that word out. And I hope that happens, after we get through this COVID-19. But I want to talk a little bit about COVID-19, because I know you're a guy that owns a business right now. You've got employees and you've been impacted by these shutdowns and things like this. And it's got to be infuriating for you to watch a restaurant with a patio be able to serve margaritas and drinks. But you're a bar and you can't serve margaritas and drinks on your patio. So what have you done to keep your business going?
Yeah, well, we're technically a restaurant now as of
okay. All right.
A month ago. We've got our 509 permit. But yeah, look, I think things, and you really can't point the finger of blame at one organization. It's easy to blame DBPR, who regulates our liquor license, or the governor, or someone like that. But we're in uncharted territory, and what's really happened, though, as I explained in the local paper, and it was we talked about before, was mentioned in the Atlantic this week, is that I call it the magical plate of food. There was there's these inconsistent rules that I know everybody's intent is correct. It's not to hurt anyone. But sometimes it's whoever's got the loudest voice. And if the restaurants have a louder voice or whatever, then it's harder for the people who don't. And so, the Florida Brewers Guild that makes up 300 breweries is not going to have the same voice that the Florida Restaurant Lodging Association is going to have,
Exactly.
and not that they're trying to do anything wrong to breweries, but yeah, we're seeing this in a few other states where, for some reason, my argument was always this with restaurants versus bars. If you're going to parse them out, why not put a curfew on restaurants? Why not require people to order food? If it's truly that the restaurant experience sitting at a table is safer and you don't want people out late, well, then why could people that have a kitchen be open until 2:30 in the morning? I mean,
exactly. Right.
Right. So that was really the most infuriating part, coupled with, that the rules don't make a ton of sense when we were doing better business when everybody was shut down, meaning when we were doing to-go margaritas and beer at the curb, but no restaurants were open, relatively speaking, of course, we weren't doing, what we were normally doing, but we were doing okay. We were treading water. Well, the second restaurants opened, our sales went down 85%. Yeah. And so, because you can go somewhere else and it's the same experience. And so that was a very frustrating time. We would do in a whole week less than we would do on a Friday in normal operation, and so, you talk about laying people off or affecting, impacting your business. And so now, we got our restaurant permit, and I do, appreciate Halsey Bashir's came to Pensacola a couple weeks back and talked with breweries and bars about how do we reopen, and when that spike comes, how do we gear down without shutting everybody down. So I know that I would say by the end of, or by Monday or Tuesday, we'll start to see what that plan looks like. But, of course, now technically we have this restaurant permit now. And we're still taking our own precautions. I mean, we're having everybody seated, really, we have the luxury of a lot of outdoor space out back. So that's helpful to us, but look, we don't want our staff getting sick, and we certainly don't want to be charged with making this any worse, for our community, but we do have a business to run, and we have people who have mouths to feed at this. And somebody will call us at the spring and say, man, it's really been tough. Our sales are down 25%. And I'm like, well, you're talking to the right guy, because we've been closed for about 4 months. So if anybody, combined between the restaurant situation and the first 60 days where we were all to go, about almost 3.5 months of full closure. So at some point you got to operate your business, and you got to support the people that work for you, that work so hard for you. And also trying to keep people safe at the same time.
So two quick questions that I just thought of in listening to your last response. We've heard a lot about no foreclosures and no evictions during this pandemic for residents, right? But what about small businesses? I mean, I'd be terrified right now if I was a small business owner and I still had my commercial properties or anything, any kind of retail business like I've owned in the past. Because if you can't do sales, how do you pay your bills? How do you pay the rent? And so in your experience, DC, is that level of forbearance being offered to those who are tenants in strip malls and commercial? I mean, or is there a double standard there?
Yeah, exactly. I mean, look, I feel like it's easy for me to say when it's when I'm on the other side of that, but I would say, you know, if at some point you've got to do the right thing. If you're a landlord who can, you know, for you to get out whole, so to speak, in the middle of a pandemic in terms of rent and things like that, while a business fails, most reasonable landlords don't want the business to fail. They don't want to have to. I mean, this is probably not a good time to put a for lease on in a building, you know.
No.
Right? So, but I'll say this: we own our building at Perfect Plain, and you know, I know banks are out. You know, we bank with Hancock, and they were you know, pushing back rent for a few months or mortgage payments for a few months if you wanted it, or going interest only if you wanted it. So banks have, and I've heard other banks, of course, are doing that. So they've done a good job. SBA actually forgave, if you have a 504 loan, which is tied to property, they've given a 6-month forgiveness that started in March. So, I mean, that's obviously huge, you know, for not just a deferral, but a forgiveness for 6 months. So, you know, you can see that different arms of the small business lending area are certainly aware of it and are trying to be as helpful as they can. But yeah, I mean, I do kind of agree with it. I don't know what the exact policy is, but why wouldn't that be the same, you know? Or at least if you could prove a certain amount of loss, you know, that'd be one thing. If you've survived it and you've never had to be shut down and your just business isn't doing well, you know, I could see that being a problem. But if you could prove that you've lost business, you would think that there'd be some leeway in that in terms of what you'd have to pay.
You know, the whole discussion of not evicting people during the pandemic, I get it. I mean, that's compassion. But I also look at the other side of the coin. If you're a retired couple and perhaps instead of playing the stocks, you've decided to purchase a fourplex or a small apartment complex, and you still have a note to pay on it. I mean, you know, you're making your mortgage because, you know, the bank out of Chicago that loaned you the money, they don't care. They want their money. But suddenly the state of Florida says you can't evict them and they're not paying. So, I mean, there's some philosophical questions there. I mean, does the government have the right to tell you you have to provide a service? Because as a landlord, you are providing a service for no compensation. I mean, to me, that's no different than saying the grocery store has to give food out because no one's got money. I mean, it's kind of a philosophical question. You don't have to touch it if you don't want to.
Look, I understand that totally. And, but, you know, it's the same thing. Of course, in my case, I'd say, well, hey, you know, the government says I'm allowed to be open. So, so that's one of those, that's one of the unfortunate situations this has caused is who gets left holding the bag. You know, is it the small business, the landlord? Is it and who knows? Every situation is different. What's the equitable way to do that? You know, and so you know, that's what just makes this so difficult. And so that's why, as I said, we're trying hopeful as we can. I know you know, there's some CARES Act money now going to some of those businesses focused on, especially on ones that hadn't received funding, any PPP funding or anything like that, which is great. You know, that's something that we focused on with our the Black-owned business micro grant program that we ran. Was, you know, the vast majority of those recipients, maybe 26 out of 29, hadn't received anything. Yeah. So you know, we just get out there and do the best we can with you know, to support those businesses and help get them an extra dollar or two to cover that rent for a little while.
Absolutely. You know, we had I had Matt Gates on the coffee, I don't know, about a month and a half ago, and really had a great discussion with him. I did ask him a question about that because the CARES Act, obviously, you know, we now see the lists of these big businesses around the country, some of whom, you know, really aren't really impacted. Let's just be very honest about it. They're still selling their product. It's something that's being sold throughout but they yet got millions and millions of dollars, and of course, trillions of dollars out of thin air just being printed in Washington, D.C. So I asked Congressman Gates about that. And, he had a good answer. I mean, look, you deficit spend when you have to. You do it during world wars. You can't penny pinch on recovery funds after a hurricane. But I think this takes on a whole new thing when we're printing trillions of dollars, and I know they're ginning up another one, which amazingly they'll get it done after the primary. It's funny, right now they're at loggerheads, but after the primary, it's funny, it'll get done. But it'll be another trillion or two, which will put us at 27, 28 trillion dollars in debt and over 100 trillion in long-term liabilities for pension costs and Social Security. And anyway, at some point, again, a pretty deep philosophical question, but you're a businessman, I'll throw it at you. Are our dollars going to be worth 85 cents, next year from all this? I mean, what's your thought on that? At some point, the CARES Act's great, giving millions of dollars to people, but doesn't that devalue our currency?
Yeah, I mean, I wish if I was a good enough economist and definitely know that for sure, I'd maybe like speculate on that somehow. But
We had Rick Harper, he was awesome. I can't wait.
right. But look, here's what we all, I think, hope for as a small business owner is whenever this light at the end of the tunnel comes, and I don't even know, everybody thinks about, oh, well, we'll have a vaccine in January, February. I mean, we may, but we don't like hit a light switch and everybody gets the vaccine. I mean, that's a months long process.
Hey, DC, are you going to line up and get it first?
Yeah, exactly. No, I have not been diagnosed, but I'm one of the ones that have convinced myself I've had it like several times. So I'm
Right.
hopefully got the antibodies, back in February or whatever. But, I think when we see that light at the end of the tunnel, what we hope is that from a consumer perspective, from all that everybody feels that same way, that eventually when we get out of this, people will have, had a long, hard year and, especially coming from a hospitality based, retail, that people are going to want to get out and people are going to want to, celebrate and be around for, in a
Yes.
group of more than 10 within 6 feet again for the first time in a long time. So, I guess any impact on the dollar from a long-term perspective that you would hope could at least be mitigated somewhat by what I would expect to see some consumer spending, but it just depends how deep of a hole do we dig ourselves in? I mean, is there dollars to spend when we get out of there in February and March? And I think for small businesses like us, that's the real question is, we know everybody's going to want to go out. Everybody's going to want to go do something. How bad will unemployment get? How bad will the situation, will small businesses shut down? And that's why it's important to keep them around because they are such a major part of our of our livelihood in terms of just as general as a county or as a state or a society.
Well, the survivors in the restaurant business will reap the reward because there will be pent up demand for the product. I mean, I've been cooking more than I've ever cooked in my life, man. And I guess that's a good thing, right? It's healthier that way. It saves money. But so look, tell us about
for your family then.
Right. Yeah. That's right. That's right. So you're somewhat of a celebrity, man. Yeah. I mean, tell us about, you're in a national publication. Tell us about that.
Yeah, that was kind of cool. The Jim Fallows of the Atlantic, who actually came down for Civicon, if you guys are familiar with the Civicon project that I used to work on. He wrote a book where he went around to, he actually knows how to fly a little plane. He's like a legendary, author and reporter, but he, him and his wife flew around the country, wrote a whole book on it, basically said, hey, we visit all these towns, and what are the common denominators in all these towns that make them successful? And so he has these 10 kind of key points that he talks about in his book. But 10A was they have a good craft beer scene, and he kind of jokes about it, but he in reality, it's what he's saying is when you have that that's locals coming together. And there was an interesting study done. I forget where I read it, but they said that breweries, amongst trustworthiness within like a community, breweries are like the number one or number two, thing, just because it's locally made. They're usually pretty community driven. They want to do good things for the community. And so I think that's kind of what he was saying is that when that culture exists, that usually means good things, that there's, positivity about the community and in these cool kind of gathering places that aren't just so much, as I say in the article, a boom, boom room in Miami Beach, but it's kind of that, familial feeling, community feeling. And so, anyway, he's putting a 5-part series together, or 4 or 5-part series on basically the state of craft beer in the entire country.
Wow.
The first article was with Jim Koch of Sam Adams that everybody remembers
Yep.
from the commercials. And then the second one was with us and Almanac in California. So, funny how, 2 or 3 years later, he's like, yeah, just sent me an email and said, hey, we're looking for a brewery like you. How are things going? And I'm like, we're selling hot dogs.
That's great.
We're
I
rest-
bet they're the best hot dogs you ever had too, right?
That's what I said. The best mediocre hot dog in a city town, if you want it.
Boiled in beer, right?
Right, exactly. Well, if the
Craft
beer's
beer.
cold, if beer's cold, it could be a great hot dog, an okay hot dog, it's fine.
Oh man, that's great. Well, I'm gonna have to come by and have a hot dog and one of your craft beers one of these days. But you are open, so Perfect Plane is open. You're open
Yes,
for
we're
business.
open. We have obviously limited seating inside, but right before we were shut down again, we spend a bunch of money on fans and misters out back. So even if it's hot, don't get intimidated. We've tried to cool it down back there. But we're kind of our normal hours that are posted on Facebook for now, because we were never, we never close it down at. Even normal operations, we even on the weekends we close 12:30, 1 o'clock. So we don't stay up until last call or anything. And but yeah, we're under 100% occupancy outside, and we have everybody's socially distant. We on the weekends we're starting to have what I'm expecting Halsey from DBPR to actually suggest to breweries and bars is to have a doorman at all times. We're going to start with that on the weekends, just because it's so hard to ask bartenders to be working with a customer, watching the door, how many people are coming in, are we breaking our number, our 50% number. It's just too difficult. And so see that coming. We have that on the weekends, which is a great problem to have, that we might be getting close to whatever our legal capacity is now. But yeah, we're open. Definitely, come see us and support us. And Escambia County and the city of Pensacola have been, our customers have been wonderful through this. And I never want to lose sight of that, because when you say, oh man, our revenue's down, hey, we're struggling, it also undercuts like the people that come and buy $50 worth of to-go beer just because they support us, and
No, that's awesome. That's awesome.
That rely on those tips. There was so much kindness that came out of even the worst times for us, of somebody buying $40 and leaving a $40 tip, because to their favorite bartender and all that kind of thing. And so I never want to forget that just because it can get lost when you say our revenue's down. But the only reason it's only down in what it was is because we have so many great people that support us. And so supporting us and our other local breweries here, these are local jobs that our businesses aren't going anywhere. We're not picking it up and moving it to Cincinnati. We're here for the long haul, and we want to make it as big and as successful as we can. So we appreciate all the support. And I know there's plenty of people in your district that come down and support us. Navy Federal, tons of employees, and the company itself has been supportive of us and had events there. And so we really appreciate it. And anything you can do for us, or just think about your small businesses. I know Amazon's easy, but I know it's
right.
But, just think about, there's people out there where their livelihoods are at stake. And that'd be the one plea I'd have for any small business out there, is that, a nice purchase from one of those can be the rent you talked about. It could be keeping that employee on for another week. And so anything you can do to support business around here is really important right now.
No, that's a great message. Yeah. Shop local, support the small businesses. They're the backbones of this community. And that's a great message. Well, DC, we're almost at the end of an hour, but I want to leave you with a philosophical question. It's just kind of I'd like to know your thoughts on, when do we step out of this crazy COVID reality? In your opinion, when does this country, this county, this community recover to a point where people can go to movies again, go bowling if they want to, go to a bar, go to a brewery like yours? When does it all get back to normal, or does it?
Yeah. I should say, even with us back to normal operations, we understand that we've already seen a significant chunk of people who just aren't going to go out. It didn't because we didn't market to them, or they didn't see our ad or anything like that. It's just people there's a certain sizable chunk of people right now that just aren't going to feel comfortable, which we understand. But we had an all staff meeting, and I said, look, guys, we need to be mentally prepared for this to be our reality for the rest of the year, at least, in my opinion. And what I hope is that, I have a theory that not even depending on the outcome of the presidential election, regardless of who wins, I could see there being, from a media perspective, and again, I spent a lot of time in, I could see that this conversation not being at the top of every single thing and maybe not
Exactly. Right.
Once this election is over, again, whether it's Trump, Biden, I don't think it matters. I think we could see kind of like hey, we're in, this is our person for the next 4 years. We don't necessarily have to spend as much time, talking about the 11 deaths in a day or the,
Right.
these, because those anything that's scaring people certainly hurts small business.
Sure.
We hope to see a little light at the end of the tunnel, but I don't know, probably if I had to guess, February or March, where I think once a vaccine exists, even if if it's not readily available, I think that is going to be the comfort level where I'm like, you know what? Okay. Just like a flu shot, just like, something that you feel like, you're going to be able to overcome, even, that there's a solution out there to overcome it. And there's not the fear that there's, it's out of your hands. I think that's when we'll start from a consumer spending standpoint. I think that's where we'll start to see people start coming back to bars or be out in public or, parades be able to happen in some version,
Yes.
Amusement parks, being at full bore and that kind of thing.
Wow. Well, we had a couple of doctors on a couple of weeks back, and I asked that question, and they both kind of told me their words were, "This is going to be a protracted situation." And when you hear a doctor tell you that, I mean, it's kind of nerve wracking. So I hope you're right. I hope your prediction's right and theirs is wrong.
Look, and I mean, as Janice knows too, is I wear this other. I'm going to be the chair of Visit Pensacola, and this is going to be the most challenging time.
Yeah. Oh God, yes.
And I believe for that, or for this organization, the most important time, when people are comfortable to come back, when we talk about lost dollars, when we talk about gas tax, when we talk about all those things, a dollar there can help to create a lot of dollars for
Coming back,
for our community. And so being ready as we can, in spite of the financial challenges that we're in, I think is going to be vital for what we do. So
absolutely.
That's
Janice, I'm going to throw the final. Oh, I'm sorry. I didn't mean to interrupt. Say again, DC.
So I just said, even in that part of our world and tourism and bringing people back here and trying to be as smart as we can about, getting those revenues back up for our county and our city, are going to be vital too. So that's something I'm going to be spending a lot of time looking at as well. So
Outstanding. Janice, any final words before we sign off?
No, I would just ask everyone to be vigilant as they have been, wear their mask when they can't physically distance, and just continue to look out for the vulnerable and those that we know are over 65 and may need our extra protection.
Right on. Well, I certainly appreciate Janice Gilley being here, Eric Gilmore, and DC Reeves. What a great chat, man. I know you're in the thick of it as a businessman, right in the middle of the pandemic. I liked your quote. What was your quote again about opening a business?
what is that? Which one?
About with either the smartest idea or the
Right. Yeah. Opening bars in a pandemic is, I don't know. Well, I'll either look back and wish I had that money back, or maybe we'll be all right. We'll see. But
right on. Well,
the smartest or the dumbest, we'll find out in March.
Outstanding. Well, I appreciate you all being here this morning. I hope everyone has a great rest of the week. And then just so everyone knows, next week I'm going on out of town on vacation to take my son back to law school at Marquette. So we're not going to have another coffee until the first Wednesday in September. So we'll take a couple weeks off, but we've got some cool things lined up for September, starting in September. And just appreciate everyone being here. DC Reeves, good luck in your new ventures. Janice, we'll be talking with you, and everyone have a great rest of the week.